CNA practice exam. 1. Which of the following should be immediately reported to a nurse when admitting a patient? A. Color of the stool and amount of urine voided. B. How much the patient has eaten. C. Bruises, marks, rashes, or broken skin. D. Requests the patient makes. The correct answer is C. Failure to notice bruises or marks on the skin on admission may later cause someone to believe you were involved in abuse. 2. When answering the phone, you should A. Take an order from the doctor if the nurse is busy. B. Say, "May I help you?" C. State your name and your department or floor. D. Say, "The nurse will answer your call." The correct answer is C. When answering the phone, you should state your name and department. 3. Which of the following things should you do to familiarize a new patient with his or her surroundings? A. Show the patient where the call bell is and how to work it. B. Tell the patient not to operate the television. C. Ask visitors to leave the room while you finish admitting the patient. D. Raise the side rails of the bed and raise the bed to high position. The correct answer is A. You should never leave a new admit until the patient knows how to call for help. 4. A nurse aide should do all of the following except A. Check signal cords. B. Raise the head of bed at mealtime. C. Administer medications. D. Check lighting. The correct answer is C. Nursing assistants are never allowed to give medications. 5. When assisting a patient in and out of bed, you should always A. Use good body mechanics. B. Get a family member to help. C. Pull the patient's feet out first, and then lift the back up. D. Put stockings on the patient because the patient may slip. The correct answer is A. You should always use good body mechanics when moving patients. 6. When should you wash your hands? A. When you notice they look or feel dirty. B. When the head nurse tells you to. C. At least twice a day. D. Before and after contact with a patient. The correct answer is D. You should wash your hands before and after contact with a patient. 7. Which of the following is the correct procedure for serving a meal to a patient who must be fed? A. Serve the tray along with all the other trays, and then come back to feed the patient. B. Bring the tray to the patient last, feed after you have served all the other patients. C. Bring the tray into the room when you are ready to feed the patient. D. Have the kitchen hold the tray for 1 hour. The correct answer is C. You should not bring the tray into the room until you have time to feed the patient. 8. A newly admitted patient has dirty fingernails. When giving the patient a bath, you should first A. Soak the nails. B. Trim the nails. C. Apply extra lotion. D. Clean the nails with a metal file. The correct answer is A. Soaking the nails first will make cleaning them easier. 9. A patient appears more pale than usual. The nurse's aide should A. Note it on the chart. B. Ask the patient how she feels and take her vital signs immediately. C. Get the patient a snack. D. Offer a glass of water. The correct answer is B. Ask the patient how she feels and take her vital signs immediately. Also, notify the nurse of the findings. 10. The most serious problem that wrinkles in the bedclothes can cause is A. Restlessness. B. Sleeplessness. C. Decubitus ulcers. D. Bleeding and shock. The correct answer is C. The most serious problem that wrinkles in the bedclothes can cause patients are decubitus ulcers, or bed sores. 11. When making a bed, you can save steps and time if you A. Assemble all needed linen before starting to make the bed. B. Tuck in bottom linen and top linen at the foot of bed before going to the head of bed. C. Use only fitted sheets. D. Ask for help from the head nurse. The correct answer is A. Gathering all supplies first is a time saver. 12. One important way to reduce the incidence of decubitus ulcers is to A. Keep the patient in bed. B. Force fluids every 2 hours. C. Change position every 2 hours. D. All of the above. The correct answer is C. Changing the patient's position every 2 hours prevents bed sores. 13. You are told to put a patient in Fowler's position. Before changing the position of the patient's bed, you should A. Open the window. B. Explain the procedure to the patient. C. Check with the patient's family. D. Remake the bed. The correct answer is B. You should always explain procedures first. 14. Frequent turning and repositioning of the client helps prevent A. Cyanosis. B. Indigestion. C. Coronary disease. D. Pressure injuries. The correct answer is D. Repositioning helps prevent pressure injuries. 15. As a safety measure, when you give mouth care to an unconscious patient, you should position the patient A. On her or his back. B. In semi-Fowler's position. C. With the head turned to the side. D. In the supine position. The correct answer is C. Turning the head to the side prevents aspiration and allows the secretions to drain out of the mouth. 16. When you obtain a clean catch urine specimen, you should A. Wash the patient's hands. B. Use clean techniques. C. Use sterile techniques. D. Perform the procedure in the bathroom. The correct answer is B. A clean catch urine specimen does not require sterile technique. 17. The client's signaling device should be placed A. On the bed. B. Within the client's reach. C. On the client's right side. D. Over the side rail. The correct answer is B. Place the signaling device within the client's reach or directly in the client's hand. 18. When lifting a heavy object, you should bend at the A. Waist, keeping your legs straight. B. Waist, rounding your shoulders. C. Knees, keeping your back straight. D. Knees and waist. The correct answer is C. Keeping your back straight forces you to use your strong leg muscles. 19. A client who is confused begins to cry and scream out for his parent. What should the nurse A do next? A. Place the client in a geriatric chair. B. Restrain the client in his bed. C. Talk to the client in a calm voice about familiar things. D. Leave the client alone in his room until he calms down. The correct answer is C. Talk to the client in a calm voice about familiar things. 20. When shaving a patient, you should A. Wet the patient's face. B. Apply aftershave lotion when done. C. Give the patient a mirror when done. D. All of the above. The correct answer is D. All the answers are correct. 21. When cleaning a patient's dentures at the sink, the reason to either line the emesis basin with a paper towel or to fill the sink with water is to A. Prevent contamination of the dentures. B. Hide the dentures from view. C. Guard against breaking the dentures. D. Protect the basin from scratches. The correct answer is C. The purpose of this procedure is to prevent breakage. 22. When assisting a patient with eating, one of the first things you should do is A. Cut the food into large bite-sized pieces. B. Wash your hands and the patient's hands. C. Butter the patient's bread. D. Provide the patient with privacy. The correct answer is B. Always remember to consider infection control. 23. A resident has a new cast on his right arm. While caring for him, you should observe for A. Pulse above the cast. B. Color and hardness of the cast. C. Warmth and color of fingers. D. Signs of crumbling at the cast end. The correct answer is C. A new cast may cut off circulation. Choice C reminds you to check for circulatory impairment. 24. Encouraging a patient to take part in activities of daily living such as bathing, combing hair, and feeding is A. Done only when time permits. B. The family's responsibility. C. Necessary for rehabilitation. D. A violation of patient rights. The correct answer is C. Rehabilitation should always be part of the care plan. 25. When giving a complete bed bath, you should A. Not wash the patient's genitals because the patient will feel embarrassed. B. Use the same water throughout the bath to save you from extra trips. C. Keep the patient covered as much as possible. D. Position yourself on one side of the bed and stay there. The correct answer is C. The other choices are wrong because of improper care techniques or body mechanics.